Hello, this is Andrew with the Get Well Now podcast. And today I'm going to be talking about bias against natural medicine. And I have an article that I read recently called Can Supplements Really Help with Depression and Anxiety? And I choose this article to discuss because it shows the bias very clearly against natural medicine in the New York Times. I've probably, since COVID-19 began, I've probably read 1,000 articles, including scientific articles for the most part, on COVID and long COVID. And I can, out of 1,000 articles, I can recall only two that said anything positive about supplements. One had to do with asking Anthony Fauci what he thought about vitamin D. And he said something like, well, I take vitamin D, but I don't endorse it. And then the only other time I heard supplements mentioned in the major media, this is out of 1,000 articles. It was the vitamins and minerals that President Trump took while he was hospitalized at Walter Reed, which is the Veterans Hospital. And so Trump took like zinc and melatonin and vitamin D, and I think vitamin C while he was being treated at Walter Reed Hospital. So though out of 1,000 articles, there should be more than two mentions of vitamins and minerals, especially when we talk about things like vitamin D, which has the ability to save lives. And there's a lot of evidence to show that vitamin D has a protective effect against COVID-19 and other infections. And then vitamin D has wonderful benefits. And the other big player on the immune system that's really known in terms of Western medicine is zinc. And the thing about zinc is that too much can be harmful and too little provides no good. So it's essential to get an optimal dosage of zinc. But zinc can be very, very protective and preventative against infections. So zinc is known to improve the immune system functioning. So I think it's important. So I really want to talk about bias in alternative medicine and also talk about the bias and how the bias affects patients. So first of all, the bias, New York Times and other major media, this could be anything from USA Today to TV Guide to the New York Times to the Wall Street Journal to your local paper. So when they don't cover any natural medicine, or they cover natural medicine negatively, despite the fact that millions of people know there's benefit, that hurts natural medicine. And it also hurts the providers, the acupuncturists, the integrative physicians, the naturopaths. A lot of these folks are very hardworking, and counter to the New York Times' opinion, they're not getting rich. Most of them are not getting rich. They're hardworking people trying to do the best they can for their patients. But then the bias is mostly a problem for the patients. The patients just want to get better. And what I'm advocating at the Get Well Now podcast here is that you do everything your doctor says, everything your HMO says, but you think about adding nutrients and herbs. And this is especially important when we have people with long COVID. So I'm going to look at this article. The article, once again, is called Can Supplements Really Help with Depression or Anxiety by Annie Sneed, and it's in a recent edition of the New York Times. It's actually June 13th, 2022. So there's one, first this is my critique of the article. So there's a sentence or a few sentences that go like this. But while experts say that some mood-lifting supplements are better studied than others, the wider evidence on their effectiveness is shaky at best. So shaky is not very a very good descriptive word for evidence, shaky evidence. And it's one of the ways, by the way, I have a degree in English literature. And so one of the things we study is textual criticism. So basically, as an English major, we look at language and we see how language is used. So when they say things like mood lifting supplements, so our drugs, I'm the professor of psychiatry, and we use evidence-based drugs. The other people use mood lifting supplements and have shaky evidence. Well, what is that? What is that about? So the good doctor, this is Dr. Gerald Sankora, a professor of psychiatry at Yale School of Medicine, says, I'm not saying that there's evidence that these things aren't useful. So he's not saying that's actually not useful. He's saying that it's more the quality of the evidence isn't to the level that we can really have much confidence in. And this is one of my key points. It looks like they're saying, oh, don't take any herbs or supplements. That's not what they're saying. What they're saying over and over in all these biased articles is that the herb and supplement is not a prescription drug. I never said it was. I never said it had equal evidence. I don't think anybody would say there's equal evidence in terms of Western science, but evidence is not just Western science. And what these people like the professor of psychiatry at Yale School of Medicine, they have a bias. Psychiatry sold out to the drug industry about 10 to 20 years ago. As a matter of fact, there was a local case where the person went into their psychiatrist and said, Doc, I'd like to talk to you about my feelings. And the psychiatrist said, I don't do talkity talk. I can refer you to a therapist, but this is a medication only visit. And that kind of comment is seen by 80% of the psychiatrists in the United States. It's just drugs, drugs, and more drugs. And maybe they'll throw in electroshock, which is another unproven therapy or largely unproven therapy, by the way. But it's interesting. They like unproven therapies if they can make money off of it, if Yale can make money and the psychiatrist can give talks on drugs. But they say that the evidence for supplements is shaky. So I think you have to look at the evidence. So the evidence for drugs is found in medical journals. The evidence for supplement use is found in alternative medicine journals. It's found in terms of people's anecdotal comments. It's also found in smaller research studies that are considered poorly designed. Well, basically most of the cancer studies that have been done in the United States are poorly designed with very low numbers. So it's interesting how they can sell cancer medicines with little evidence, but if we try to sell herbs or supplements with little evidence, then that's a problem, or quote unquote, there's no evidence. So the Dr. Sankora says on St. John's wort, there's actually been a fair amount of work done on St. John's wort over the years, but it's still not the high quality evidence that you would see for a Food and Drug Administration approved drug. Okay, so all that statement says is St. John's wort is not a drug, right? It doesn't have the same evidence. But when we look at the evidence, I could write an article with a similar tenor called Can Antidepressants Really Help with Depression and Anxiety? This article is Can Supplements? But I could turn it around and say, can antidepressants? We do not know if antidepressants work, and we don't know how they work, right? So all this thing about, it's not high level evidence, but Prozac or these type of drugs, no strong evidence that they are effective. Now there's anecdotal comments, just like there is with herbs and nutrients. I met Marge and she took Sam E for her depression and the depression went away. Well, it's the same thing with antidepressants, but the only thing that we should know about antidepressants is the side effects and the difficulty getting off of them. So Andrew's approach is, well, why don't we use something natural, which may not be as effective, but it has far fewer side effects, and people can go off St. John's wort without going into a psychiatric emergency. I had a patient in our clinic who was on, I think the drug was called Zoloft. And her doctor she said, I want to get off my Zoloft. It was a while ago that I got on it. I got on it because my husband died. And so she said, so doc, I want to just go off my Zoloft. And I've heard that, you should be careful about that, because that's what she'd heard from a friend. And the doctor said, oh no, don't worry, just go off it. Anyway, so she stopped taking it one day, and it was right before a flight. She didn't take her dose that morning, and she got on a flight, and she said, The whole flight was 2 hours. And she cried the whole time and started sweating and having other signs of panic just for not taking an antidepressant one day. These drugs are very hard to get off. So anyway, St. John's wort is not the best natural treatment for depression. Cut through, the best natural treatment for depression, in my opinion, is called SAMe, which is a type of methionine. And it's often called, spelled with a capital S, a capital A, a capital M, and a small e. And it's a kind of methionine that's widely used in Europe as a prescription drug for antidepressant. So it's sold in the United States as a supplement, but there's enough evidence that it can be a prescription drug in, I believe, several European countries, including Italy. So the real problem with St. John's wort is that it interacts with a lot of drugs. So they also say that experts also advise caution when taking it because of the potential for adverse interactions with other drugs. Now, how many times have we heard that? Oh, you shouldn't use herbs because they interact with drugs. Well, the greater danger is drug-drug interactions, okay? Now, it's not uncommon these days for people to be on 2, 3, 4, 5 different psychiatric, psychotropic medications, including antidepressants. And once you get past 2, there's not a lot of evidence, a lot of studies that show the safety of 2 antidepressants. There's very little research, very little evidence. But when we get down to 3, there's nothing. There's no evidence. So that's the way people really use antidepressants. And it's part of this whole, co-opting of the psychiatric profession that to become drug pitch people, right? Not doctors anymore. And this really concerns me because the amount of people on these drugs and the side effects that they are subjected to. And, they used to say, oh, well, if your antidepressant doesn't work, then try a different antidepressant. Now they say if your antidepressant doesn't work, add a psychotic and antipsychotic medication. So they have hundreds of thousands, if not millions of patients with regular depression that are on antipsychotic medication simply because that's what the psychiatry profession has sold them. Okay, the next knock is on omega-3 fatty acids. Again, the article's entitled, Can Supplements Really Help with Depression and Anxiety? And I'm really showing you the bias. And so there are studies, there's a lot of studies on fish oil. What you should know is that not all the studies on fish oil show that fish oil in capsule form works. There's better evidence that show that people that eat fish have healthier immune system, healthier heart health. Okay, so we pretty much know for a fact that people who eat a lot of fish in their diet, and Andrew would recommend taking fish oil supplements too, do quite well in terms of suppressing inflammation and also supporting brain health and reduce things like depression. But dosage is very important, and also it's also really important to consider food as part of the way you get fish oil. And so basically they quote a different psychiatrist. Again, I really question why they're asking psychiatrists that don't use supplements about the use of supplements. That's called, I don't know, that's either a conflict of interest or the reverse of a conflict of interest. Okay, the doctor at University Grossman School of Medicine, professor of psychiatry, says it's very mixed data and some studies don't show that much benefit. The data are somewhat controversial. That's about fish oil and depression. The same exact thing could be said of all SSRI antidepressant drugs. I should say now that I'm a big fan of David Healy, who's a medical doctor. His name is spelled Healy, Healy, and he's an MD. And he's written about 5 books. Off the top of my head, I can just think of one title. It's called The Antidepressant Era. And what's interesting thing about Dr. Healy is that he started out as a conventional psychiatrist. And then the drug companies wanted him to analyze their drugs and do research. And he said, sure. And he started seeing side effects, including suicide ideation, people thinking of suicide on these antidepressant drugs. And these were people who weren't they weren't suicidal before they got on antidepressants. They got on antidepressants, they became suicidal. So David Healy, after doing all this research and writing all these books, basically thinks that SSRIs are a terrible way to go. That there's acupuncture, there's hypnosis, there's herbal remedies, there's even other types of antidepressants besides SSRIs that he thinks are very useful short term. So you're interested in the whole scuttlebutt about antidepressants, check out David Healy's book. The next one they talk about is methylfolate. This is a type of folate, which is a B vitamin. And they say basically that there's limited evidence, or there might be evidence for some people with not the others. And of my favorite antidepressant nutrient, Sam E., he says, there's not really strong data to support their use. Well, there was strong enough data to support the use in France and Italy, where it's approved antidepressant medication. So there is enough evidence in Europe, but not enough here. And so part of that could show you the difference in the United States and Europe. In Europe, doctors are encouraged to use more herbal medicine. For one thing, their patients demand it or want it. Also, the patients in many European countries, such as Germany, oftentimes try plants first and teas first before they want to resort to pharmaceutical medications. So it's interesting where the United States, they don't really want to look, mainstream medicine doesn't want to look at supplements. They don't want to look at diet and lifestyle. But what they want to do is develop newer and newer, more expensive and more drugs with side effects for depression and anxiety. So then he gets into supplements. And he says that, now we're back to Dr. Sankora of Yale Psychiatry School. He says that of the anxiety medications, they don't have evidence, but that doesn't mean that they're not effective. So that is a very powerful take-home message, right? Just because a doctor or the FDA or Anthony Fauci or somebody says that there's no evidence doesn't mean that they're not effective. Now, the next part of the article goes on to say, is there any harm to trying them? So I've been in the health business for 40 years. I've treated patients and had a practice for about 35 years. And for that length of time, I've always heard this comment. So if they have the slightest evidence that the herb might be harmful, oh, it's blasted all over the place. But if they don't have any evidence that it's actually harmful, then they say, well, the problem is you're wasting your money. The patients are wasting their money, and then they're not getting the real treatment. And so here they're talking. So in my humble opinion, the real treatment for, emotional and psychiatric problems is probably a combination of medication and pharmaceutical medications or supplements and some sort of therapy as well as occupational therapy. And then the other aspect with psychiatric illness is that they have to be off all recreational drugs and alcohol. Very, very important. Okay, so the problem is when they compare supplements by themselves to drugs by themselves, yeah, the drugs by themselves work better, but that doesn't mean that anybody says that herbs should be a substitute for therapy or to see a psychiatrist. So again, if people are just stressed out, they probably don't need to see a doctor. They just need to do stress relieving activities. But if you're really depressed, yeah, it makes sense to see a doctor, to talk to people. And if it's mild to moderate depression, I don't think there's any reason why you shouldn't try an herb or a supplement. If you do have major depression, you really should see a doctor, a psychiatrist, or your HMO. Okay, so then we talk about, so this is another quote by a different psychiatrist. who says another potential risk of supplements is a paradoxical one. They could exacerbate a mental health condition. Dr. Neustadt said that there is some evidence, for instance, that St. John's wort can potentially induce a manic episode in people with bipolar disorder. Now, that is a very misleading statement. And it goes back for about 20 years. About 20 years ago, somebody did a study that showed that St. John's wort increased serotonin. And so when it's an SSRI antidepressant, they want to increase serotonin in the body. But all of a sudden, somebody said that St. John's wort increases serotonin. And then they said, oh my God, that could lead to serotonin syndrome. We better not use St. John's wort. Well, I talked to a colleague of mine who is a psychiatrist who believes in natural therapies first. He does use drugs, but he uses natural therapies first. And he said serotonin syndrome, what, there's like 10 cases in the world of serotonin syndrome, and it's almost all drug-induced serotonin syndrome. These are people who are taking too many or overdosing on their antidepressants, not somebody who adds St. John's wort to an antidepressant. Maybe that happened once in the worldwide literature, but it's hardly something worth reporting about. So basically, the Dr. Sankora says he's much more worried about the risk associated with delayed effective treatment. So you could also say that, if a general practitioner, they used to say that it takes less than 5 minutes for a general practitioner to write an SSRI prescription. That's not good medicine either. So somebody trained in mental health should be evaluating these people, and then treatment options should be discussed, not just see a psychiatrist get put on a toxic antidepressant. So it is true, though, that if you do have serious depression, it is really important to see a health professional, especially a mental health professional. The article ends, and again, we're discussing, can supplements really help with depression and anxiety in a COVID framework? They talk about, so traditional medicines and psychotherapy work, including antidepressants. Again, it's not clear-cut evidence that antidepressants work. There's some evidence that cognitive behavioral therapy, a type of therapy, works for depression. And he says that they have the highest quality of evidence. But he also mentions treatments like transcranial magnetic stimulation, TMS. Now, it's so interesting. The same doctor, the professor of psychiatry, clearly doesn't like herbs and herbs and nutrients, but he likes drugs, and he likes things that techniques that doctors administer, like TMS, which is transcranial magnetic stimulation. So I do want to also say that there are non-invasive therapies that don't include herbs, drugs, or supplements. And that an example of that is transcranial magnetic stimulation. Now, also, the other reason that I mentioned TMS is that it's also found to be helpful in the cases of long COVID and people that have sleep disorders, anxiety, depression, and certain ears, nose, and throat. I believe there are certain ear, nose, and throat conditions associated with COVID, long COVID, that respond to TMS. And then we all know, natural therapists as well as psychiatrists know, that exercise can be very beneficial. And then they add that there may not be good data, but it's very practical and it's very safe. So again, they like exercise because it's not a supplement, so it doesn't compete with a drug. And in that case, there may not be good evidence, but there's really few side effects. And so I just question why exercise is good that has few side effects, but supplements that have few side effects aren't. And so part of this, I believe, is the psychiatric industries and big pharma's industries sort of reliance on big psychiatric medicines for a large part of their profits. So I have some concluding comments that I want to make. So first of all, you say, well, what does supplements and depression, anxiety have to do with COVID and long COVID? Well, I know that a lot of people that have long COVID are trying supplements and herbs for depression, anxiety, and insomnia. So I don't want to, discourage these people. I think they need to be encouraged to try out of the box therapies because right now there is no approved drug for long COVID, and it's probably going to be a long way off until they do develop an approved drug. So that's why we need to experiment, try herbs and supplements. Now, I also want to say that in the series, I talk a lot about finding a natural health professional, finding a healer, somebody that cares about your health, somebody that you can see in person, somebody that can be your cheerleader, somebody that can be your monitor. When I was doing the clinic, I did the clinic in Oakland for about 15 years. And there was at least one, I think there was two patients where we referred to the emergency room. And one we said, ma'am, you need to go to the emergency room right now. And the other we said, well, you need to go to the emergency room sometime between today and today and tonight. So part of monitoring is a good natural health therapist, whether they be an herbalist or a integrative physician, should be able to say that, you really need to see a mental health professional. You really need to see a different doctor, or you may need to go to a long COVID clinic. So it's finding, monitoring your health and being able to present referrals is very, very important. So we'll be having various weeks and various series where we talk about long COVID and natural medicine. And I just want you to think about, for the viewers and the viewers' friends and families, don't get discouraged when you hear these articles they appear to say that you shouldn't ever take supplements. But when you really read them carefully, line by line, they just say things like, well, there's not enough evidence. And that lack of evidence is from a Western medical big pharma perspective. And also lack of evidence does not mean ineffective. Well, this concludes today's workshop for our long COVID and COVID series on using natural medicine. And I want to suggest that you visit us on our website at getwellfoundation.org. Have a great day, and we'll see you online.